Hello, everyone. My name is Lucas Elliott, and I will be presenting Using Exercise as a Stress Management Technique During the COVID-19 Pandemic, College Student Gender Differences. As a background, psychological stress is a major concern for college students and can lead to negative health consequences such as depression. Stressors are seen in many different forms, and the COVID-19 pandemic lockdown showed an increased amount of these stressors, especially in college students. Psychological stressors affect individuals differently based on many different graphics and determinants. One notable difference is that women tend to be more negatively impacted by psychological stressors compared to men. Although there are many ways to deal with this stress, one stress management technique that is shown to prevent and treat psychological stress is exercise. The purpose of this study was to understand possible gender differences between how using exercise as a stress management technique predicts perceived psychological stress levels during the COVID-19 pandemic lockdown. For this study, Penn State students completed an online survey in the spring of 2020 after the COVID-19 stay-at-home orders were nationally put into place. The participants self-reported demographics such as age, race, ethnicity, semester standing, gender identity, and sexual orientation. Stress management techniques including but not limited to medication, exercise, drinking alcohol, and sleep. Perceived psychological stress was reported using the PSS-10 questionnaire, a validated and reliable measure of perceived psychological stress in college students. And participants also reported GPA. Participants were then dichotomized into two groups based on if they used exercise as a stress management technique or not. For all statistical analyses, tests were conducted using SPSS version 26. The two types of tests that were conducted were independent sample t-tests for each PSS-10 item to compare who did use exercise as a stress management technique and those who did not use exercise as a stress management technique for both genders, as well as independent linear regression models conducted for both men and women to show the significance of using exercise as a stress management technique in order to predict stress level variance. Race, ethnicity, sexual orientation, and GPA were used as covariates. The sample consisted of 384 undergraduate Penn State students, and the average age was roughly 20 and a half years old. The majority of participants were women, non-Hispanic white, and straight heterosexual. Table 1 shows a complete summary of demographic frequencies. This table represents the results from independent sample t-tests performed for each PSS-10 item by gender to test the difference between each item's rating with those who used exercise as a stress management technique versus those who did not. 4 PSS-10 items surrounding the theme of life control were associated with higher levels of perceived psychological stress in women who did not participate in exercise. These items were, in the past month, how often have you felt nervous and stressed? How often have you been able to control irritations in your life? How often have you felt that you were on top of things? And how often have you felt difficulties were piling up so high that you could not overcome them? Men showed no significant differences in these PSS-10 items. This table represents independent linear regression models that were conducted for each gender separately. The model showed that women who use exercise as a stress management technique were predicted to have significantly lower perceived stress levels compared to women who did not use exercise as a stress management technique. Covariates of race and ethnicity and sexual orientation also significantly predicted the variance of a woman's stress levels. In men, using exercise as a stress management technique did not significantly predict the variance of total stress levels. In conclusion, the results of this study suggest that there are gender differences in how perceived stress levels are predicted by exercise. Female students who use exercise as a stress management technique were predicted to have a significantly lower stress level score overall than those women who did not, while in their male counterparts, men did not show any significant change in overall stress score dependent on whether or not they use exercise as a stress management technique. University administration and public health officials should take note of these results when creating programs tailored to lower stress levels amongst their students or their community members. Thanks for watching.